So it's a great pleasure to be able to join this amazing international virtual conference today to talk a little bit about what's been happening recently at Sydney Children's Hospital in Australia to try and support families who have a child with Kleefstra syndrome. My job as a clinical geneticist is one I feel incredibly humbled to do so. I'm a doctor who trained as a pediatrician, and I see my role as to listen to families who have a child with a suspected rare genetic condition and see how I can try and address their questions, their concerns, and be part of a journey with them to make sure they get what they want, which is the best possible outcomes for their child. And I think that starts with listening to families. There's a lovely quote from this book: when in doubt, ask the experts, those with a lived experience and those whose voices have not been heard. And I think sadly, so often families who have a child with a rare condition don't have their voices heard. They're just struggling to get through each day, trying to get across the difficulties of living with a child whose symptoms don't make sense, who have a child with a condition that hardly any other doctor or allied health professional has ever heard of. And if I can be some small part of trying to join those dots together, but also connect up families with amazing global communities like this one, so that families can learn that they're not on this walk alone, and that I can learn and share from them and hopefully pass on that wisdom to help other families. So we have a beautiful little girl here. Very grateful to the Corey family for sharing pictures of the beautiful Gabby, who has Kleefstra syndrome and has absolutely amazing parents who say, this isn't right. This isn't right that we should have such a struggle to get a diagnosis and to get the support and care and the opportunities for research and clinical trials that our child deserves. And we hear you, and we would love to continue on this journey to try and get better solutions for all families with a beautiful child like Abby. So a little bit about Australia. You may tell from my accent that Australia is not my birthplace. I was born in the north of England, but I've been very lucky to live here for the past 20 years. And as of this week, we have 25,856,834 people in Australia. That's one birth every 1 minute and 45 seconds. But I also want to make the point that we're a very multicultural community, and one person arrives to live in Australia every minute and 1 second. We have a history that goes back many millennium before the migration of people from Europe, and there is a incredibly complex and wise society of Indigenous and Torres Strait Islander people here. And like I mentioned, we are a very diverse community now, and a quarter of our population is born overseas. Mostly Australians live around the coast of Australia, and we have a state-based health system with different states having slightly different approaches to health. What all of these things put together means is that healthcare is not yet equal across Australia. For those living in rural and remote areas, for those of Indigenous heritage, and for those of culturally and linguistically diverse groups, there are more barriers to accessing excellent healthcare, and that's something that we want to work very hard to tackle, to make sure that every child with a rare disease gets the best possible care and support. In 2020, Australia launched its National Strategic Action Plan, which was endorsed by the Australian government. And it talks about the vision of the best possible health and well-being outcomes for Australians living with a rare disease, which is 3 million Australians. Critical enablers are listening to families living with rare disease and working in partnerships with our governments, our state and national governments, but also looking abroad for global collaborations, and to try and understand how to provide the most high quality, comprehensive and integrated healthcare for those living with rare diseases that truly is person-centered, which means tailored to each individual person. I work at Sydney Children's Hospital, which is part of Sydney Children's Hospital's network. Together, these are two children's hospital sites across Sydney, and we make up the largest hospital network in Australia. This is where our hospital is, very close to the ocean and also very close to the city. We're developing as a hospital network with expertise in digital health, and the pandemic has shown us that we can pivot to effective telehealth, which often means we can connect up with families, avoid them having to come into the hospital, but also connect up better with their local healthcare providers so that they are really empowered to work in partnership with families. And we're also very much at the fore of advanced therapeutics in Australia, which means things like gene therapy. And we were the first site in Australia to give gene therapy for spinal muscular atrophy and for childhood retinal disease. That's a blinding eye condition. And across the two hospital sites, we see about 2,000 new families a year with a suspected rare condition like Kleefstra syndrome. And we've listened to families, and what we hear is really the ideal is to have a multidisciplinary clinic for rare disease. So one where we can act as a centre of expertise and a point of contact for the local medical team, so the local primary physicians, paediatricians, gastroenterologists, neurologists, so that they can share and understand the really world-class expertise in a rare condition like Kleefstra, but also to be a point of contact and support for families, and also connect those families for those individuals where they want those connections in informal and more formal ways. And also really critically for those families who are interested to know about advances in research, get our families what we call clinically trial ready. So to be in the best possible position to not only attract clinical trials, but hold successful clinical trials as new therapies come on board. So we've been working over the last few years about a framework and a structure to put all of our families, all of our rare disease families in the best possible position to get excellent care when they have a child with a rare disease. It starts with our patient registry called GeneStart, which helps us identify cohorts of families. So that means groups of children with a particular rare disease like Kleefstra syndrome. It also helps us when children don't yet have a very clear-cut diagnosis to tap into research opportunities locally and internationally to fast-track them to a diagnosis. And that's part of our program called GeneAd. And then where we'd really like to go is to putting all these things together to have these multidisciplinary clinics that offer the best possible care. And over the last couple of years, we've actually been quite successful in getting some funding for parts of this, in particular our patient registry and our undiagnosed disease programs. So with Gene Together, we wanted to start somewhere, and we started with Kleefstra. So our current Kleefstra clinic is very much held out of our genetics department. I'm lucky enough to work with Caroline Chalhoub, who's a senior genetic counsellor in our unit, Dr. Lisa Ewins, a clinical geneticist, and Rebecca McIntosh, a genetic counsellor. And we all are affiliated with the university, so we have an academic role as well as a clinical role. Lisa is also at the Garvan Institute, and I'm also leading a national program which is about trying to improve the understanding and awareness of doctors and allied health professionals about rare diseases. And all of these we bring together to try and put us in the best possible position to support families. And this is the idea, is that families can be referred to our Kleefstra clinic actually from anywhere in Australia. So when they are referred to our service, we will ask if we can collect information not only about their genetic diagnosis, but all of the investigations that have happened before, because it can be exhausting going through and telling the story again. So we want to try and shortcut that as much as possible by gathering the information that has already been done by the local doctors and the local teams. And then through seeing the families in our clinic, we can let them know about patient support groups. We can also collect all of that information together in a letter and identify if there's any gaps, if the families are not meeting any of the recommendations in the management guidelines for Kleefstra syndrome as they currently exist. And we're also part of the international collaboration to further refine those guidelines. So if there are some gaps identified, we can help either refer those families to the services that they need or let their local health teams know what the referrals are that we would recommend. And really critically, we're understanding that I think every single family we've seen is interested to learn more about research opportunities. So we start that by offering them enrolment into Gene Start, which gives them us the permission to allow families to connect up with clinical research databases and enroll them in research trials as those come up. But also really importantly, it helps us to understand how we can do better. So as part of Gene Start, we have the option of families joining focus groups or having interviews so we can understand what we're doing okay and where we can do better. And also by being on our registry and being connected in to this telehealth clinic, we can let them know about new research opportunities as those come along. So for example, for another group of patients who've got genetic epilepsies, we've held a couple of family days which have been really successful in joining up families, and we'd love to do that for Kleefstra soon. And we have various smaller projects that come along the line, and by enrolling into our registry we can let people know about that. So for example, for those with epilepsy, we're running a current pilot where families can learn and ask the questions they want to know about their child's epilepsy or the management of their child's complex condition. So we started towards the end of last year, and we've been lucky enough to meet with 10 amazing families and 4 more booked into our next clinic. We started with children across our network, but we've extended that out, and actually the hospital is happy for us to see families from all across Australia because there is no other equivalent clinic yet in other states. So our genetics counselling team will usually ring the family before. As I said, that will help fast track collecting all of that information so that we don't need to spend so much time in the appointment going through everything that's happened before, but also really importantly ask the families what is it that they would like to get out of the clinic, what are the questions that they have that they'd like to be addressed. As I mentioned, we then check that the management guidelines are happening and are there any gaps where we can help advise their local teams regarding specialist referrals, and we inform them about our patient registry and research opportunities. We then put all that information together in a letter that goes back to the family and their local clinical team. So it's really about trying to empower that local team. And we're also happy to help with patients navigating things like the disability sector, referring them on to appropriate support organisations and offering them a review as well. So here are some themes. My first theme was that our families rock. It is humbling to meet every single family and hear about what amazing advocates they are for the people in their lives with Kleefstra syndrome. Sadly, we're hearing about very varied access to specialists. Some have got very engaged, often a general paediatrician who's really good at referring them to the supports they need, and others that's been more of a struggle, which is where hopefully we can step in and help with that process. And time again, we hear about how hard it is having a loved one with a rare condition and having to retell that story every time and feel isolated. So hopefully our clinic will really importantly try and bring together some community of families to reduce that isolation. We also know it can be really hard in Australia to explain to our disability and education sectors what having a rare condition like Kleefstra is. So this is somewhere where we can particularly help with, for example, letters to the National Disability Insurance Scheme to try and make sure that children are getting the appropriate therapies that they should be and should be appropriately funded for. We're also growing our little black book, as I like to call it. So when we hear about a hero specialist, a wonderful gastroenterologist, a fabulous sleep physician, a really good psychiatrist, then we note that down, and that's someone that we might recommend to the next family we see if that's a gap in the care for their loved one. And like I mentioned, almost universally families are interested in connecting up with other families and in hearing about research. So our hopes for the future is that we might be able to secure some funding to have a true multidisciplinary clinic rather than seeing the families and then referring them on to specialists, to actually bring all those specialists to the family, which would be the ideal situation. And also, we're so excited. We're bringing other advanced therapeutics trials for other conditions, as I mentioned, into Sydney Children's Hospital Network, and we really want to make sure that we're putting our families in the best possible position for those clinical trials. As I mentioned, we're really looking forward to developing a local family day so that families can connect, hopefully when this pandemic is settling down and we can have the opportunity of actually meeting face to face, which would be wonderful. And we would love to grow what we're learning from this process to be a model of care that we can apply to other children, other families with other rare neurological and neurodevelopmental conditions. So thank you very much for your time listening today. That's my contact details, elizabeth.palmer@unsw.edu.au. And please don't hesitate to reach out if you've got questions. And I'd love to connect and hear from more of you. Many thanks.